In context of modern society, the term plastic surgery most often conjures images of busty swimsuit models with finely sculpted noses and plump lips. It has been popularized in movies and on TV shows such as Baywatch and Nip Tuck. Readers of fashion magazines are bombarded with before and after images of their favorite celebrity. However, contrary to what many people may think, most plastic surgeries are not purely cosmetic purposes. Despite the seemingly sterile and fashionable modern plastic surgery, its origin dates back several thousands of years, and periods of rapid advancement of the profession were often driven by war. Plastic surgery dates back to ancient times, but war has often been a catalyst for its development. We will first explore the practice of plastic surgery in ancient times. Next, we'll fast forward to pre-World War I era, and then finally we're going to examine the development, the discipline during World War II. Plastic surgery was first found in ancient times. The Romans performed rudimentary forms of plastic surgery, often to repair injuries sustained during battle or due to animal attacks. According to an article on unrv.com, they performed minor procedures such as otoplasty, which is repairing of damaged ears, and more complicated procedures like scar removal. Meanwhile, around 800 BC, the father of Indian surgery, Sushruta, made significant contributions to the field of plastic surgery. A January 2000 article on veganprasser.gov.in explains in India from ancient times to the early 19th century. We find a living tradition of plastic operations of the nose, ear, and lip. Little was available during this period to control pain, as with any surgery performed. During the time, the risk of complications and infection was extremely high. As you can see, simple plastic surgeries were first performed in ancient times. Now let's examine plastic surgery in the new World War I era. Little change in this field until the introduction of new ferocious weapons of war in the 1800s and early 1900s. The horrendous injuries inflicted by these new weapons required significant and accelerated advancements. To treat and cure with never-before-seen frequency, this also unified the separately instilled in its academic integrity. According to the American Society of Plastic Surgeons, some of the best medical talent in the U.S., Britain, France, Germany, Russia, Austria, Hungary devoted themselves to restoring the faces and lives of their countrymen during and after World War I. In the U.S., one of these surgeons, hired by the U.S. Army, Valerie Blair, treated vets with complex facial injuries. In his paper, Reconstructive Surgery of the Face, set the standard of facial reconstruction. In 2009, Annals of Plastic Surgery, Chambers writes, a New Zealand otolaryngologist working in India, Harold Gillies, developed many of the techniques of modern plastic surgery in caring for soldiers suffering from disfiguring facial injuries. Yet much of the field was still in its infancy. Clearly, plastic surgery advanced rapidly during the World War I era. Now we're going to examine developments during the World War II era. During the years between wars, plastic surgery flourished in the U.S., but in Europe and other parts of the world, it had stagnated. The arrival of World War II advanced the discipline by leaps and bounds as war once again ravaged the bodies of young soldiers. In the 2009 Annals of Plastic Surgery, Chambers explains Gillies' work of World War I was expanded upon during World War II by his cousin and former student, Acrobod McLindow, who performed treatments of RAF aircrew suffering from severe burns. Nearly every facet of the field advanced during the war times. From an academic perspective, the changes fueled by war are striking. According to the Pakistan Association of Plastic Surgery's History of Plastic Surgery, only 20 medical schools with divisions of plastic surgery existed in the U.S. prior to the war. By the early post-war period, nearly 70 divisions of plastic surgery had been founded. The combination of advances in plastic surgery performed during this time period with advances in other medical procedures, such as anesthesia, ignited the growth experience in the post-war years. Plastic surgery in the modern age is undertaken not only for the division's physical and functional benefits, but frequently mental health benefits as well. While the images of painless procedure is certainly an illusion, improved pain control and the professionalism most surgeons exhibit makes it a compelling option. In the last year, there have been 2 stories of individuals undergoing seemingly impossible full-face transplants. With ongoing wars around the world, the field will undoubtedly continue to advance. But will war continue to be the stimulus? Or will we find rapid advancements in many scientific and medical disciplines overcome the primary driver? As I conclude this speech, please imagine what will be possible with plastic surgery in the years to come and how it will impact patient lives.